People infected with COVID shed the virus in their stool before they have symptoms. Since 2/3 of the county's waste ends up at the sewage plant in Point Loma, the treatment facility is a treasure trove of information for researchers at UC San Diego School of Medicine who track the spread of the coronavirus and its mutations. The latest test showed something researchers had never seen before.
We saw near doubling of viral loads in our wastewater within a week.
Dr. Smithy Kartikane is a researcher at the night lab at UCSD. She says locally, Delta is the predominant variant now, but there's a good mix of the Omicron strain.
If you're seeing it in the wastewater already, it means that it's definitely spreading in the community.
She says this means there will be a surge in detectable cases in both Delta and Omicron within a week or so.
In a lot of ways, this wastewater can give us a good lead time sometimes if there's not enough testing to make any public health interventions or at least warn people.
And this information is important to people like Dr. Jess Mandel, Chief of Pulmonary and Critical Care Medicine at UC San Diego Health. He says this data confirms what they've been expecting.
We're really preparing ourselves for the next wave of COVID infections that we've been expecting for some time. And with the emergence of the Omicron variant, the timetable, I think, has shifted up, that this is really a very infectious variant, and we expect to see a big spike very soon.
Dr. Mandel says this forecasted surge couldn't be hitting at a worse time.
I think one of the troubling things for us is that this occurs on a backdrop of the hospital being extremely busy with non-COVID patients as well. And so, the system is already being strained a little bit by everything else that's going on. And now we'll probably have a big upsurge in COVID on top of it.
Despite local hospitals having plenty of PPE and other supplies on hand, Mandel and other doctors are worried Omicron could be a game changer.
Really, what we're most concerned about is having enough people, really the human resources. Because this variant is so infectious, we expect that doctors, nurses, and others will get infected along with other folks in the community. And that really impacts our readiness and our ability to field the team.
So they're urging their staff to be extra vigilant. Kitty Alvarado, KPBS News.